So the WHO is trying to figure out where the concern is for antibiotic resistance and what they can do with the information that they've gathered from these different countries. Now, it's very important that as many countries as possible collaborate. And I hope you read the link I provided earlier this week that, for instance, China is given some resistance on providing information on strains of avian influenza where they're having issues within their country. So they used to do it. They used to provide freely, information on various outbreaks or concerns where strains have popped up, but the last year or so, they have not. They have backed away from doing that. That is not a good situation, especially since a lot of our avian influenza strains tend to come out of China. So that they're not providing information is not a good thing. Well, here we have, and I will repeat it again, of the 52 countries currently enrolled in GLASS, so there's 52 countries that are enrolled in this surveillance system, 40 provided information on their surveillance systems, and 22 provided antibiotic-resistant information. Not very many, considering that 52 countries had actually signed up to be part of it. So if we're talking about how to resist resistance, right, we need to talk about what we are resistant to as a society, as a community, as a country. Right now in the United States, we are seeing a problem with sexually transmitted diseases, or STDs. Ones like gonorrhea that we could typically treat are not being treated. It's not susceptible to the antibiotics that we typically were using. Problem. Why? Well, part of having a surveillance system is helping us to determine why. Sometimes we develop a resistance because we don't seek treatment as we should. Sometimes it's because we are not taking the medication as we're supposed to. And that's what I'm going to kind of focus on here for a moment. So, speaking to professionals out there, we have to make sure that when medication is prescribed, that we are, one, giving the right antibiotic or the right medication for the condition that we're trying to treat. But we also have to really, 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 really make sure we're giving out accurate information. I'll tell you a pet peeve of mine. If you know TID, okay, professionals know what TID is. That means you're prescribing something 3 times a day. I never tell people, in the veterinary hospitals I've been, I don't say, here, give it to your pet 3 times a day. Okay, I do not put it to them in those terms. I tell them to make sure they give it every 8 hours. And I tell them to be as consistent as they possibly can when they're starting that medication to do every 8 hours. We know that medication has to have a certain threshold, has to have a certain concentration in the system to provide treatment, right? So if there's an inconsistency and that threshold changes, that we have a lot of ups and downs, then we know it's going to affect the effectiveness of that medication. We know that. So I try to instill that in pet owners. If it's supposed to be 3 times a day, then I tell them it's every 8 hours, and they need to be as consistent as possible. That also means that, something I can give as an example in veterinary medicine is that sometimes we have a tendency in the field to give in to pet owners that want something for their pet that we know is probably not going to work. And I've heard of the same thing in human medicine. I've heard of other professionals discussing it. That a patient insists on antibiotics, even though they believe it's not bacterial, it's not going to do anything, and they prescribe it anyway, okay? But although I know of that, I've heard of it, I'm going to speak about for a minute in veterinary medicine. I'd say probably the most abused medication that I've heard veterinarians say that they didn't think they needed it, but they went ahead and gave it, was steroids. That's probably the biggest. A pet owner comes in, oh, Fifi is itching like crazy, and they insist, and I've heard some demand, not short of, I'm talking about demand, a steroid. Well, here's the problem. First of all, it's something that if you caught it early enough, maybe you could have used Benadryl or diphenhydramine, right? Over the counter, it's cheap. It could have been something like that if you had done something earlier. But the concern is with using something like a steroid, the reason why it works on paretic or itchy pets It's because it affects the inflammatory system that's making the itchiness. Okay, I'm not going to go into any great detail. Those of you that are professionals know what I'm referring to. Laypersons, I could do a whole segment and probably not even cover, I wouldn't be able to cover the whole inflammatory process. But it affects the inflammatory process, which helps inhibit the itching. Okay, that's what steroids do. But here's the problem, is that it also affects the pet, their overall immune system. So it has a potential to make them more likely to pick up something they typically wouldn't have picked up before. So there's a danger with overprescribing steroids. So when we're talking about antibiotics, we talk about giving them to an animal or a person, right, that is not necessary, and we talk about providing them a medication because they're insisting, and I'm going to be rather frank here, sometimes we need to have more of a backbone and say no. It's not going to work. If they go somewhere else, they go somewhere else. But we don't want to do anything that's going to possibly inhibit the health of the community, because then it increases the likelihood of, if they catch something, of it circulating. It doesn't usually affect that one animal or person, right? So we need to make sure that we're giving out the proper medication. We're sticking to our guns when we know it's something that's not going to work. Now, lay people out there, if you're told to take a medication every 8 hours, and you're given it every 6 here, every 10 here, it varies, you're creating an environment to increase the likelihood of antibiotic resistance. It's a scary situation when I read that paper from the WHO, from the WHO, that talks about something like a urinary tract infection, right? We see this commonly in senior citizen populations. I don't have it in front of me, but I would assume they're probably the most vulnerable, okay? And you're talking about a drug, Cipro, that we commonly use for UTI, for urinary tract infection. And we're talking about statistics that say up to 65% of them not working. If it's a medication that would typically have treated that bacterial infection to begin with, and now we have nothing to treat, something that could have been a simple infection can end up affecting multiple systems, multiple body systems, multiple organ systems within that patient or that pet. Not good. Okay, so as a person that is either your pet is taking it, medication, or you are the one taking it yourself, if it's for something, an infection that you have and you've gone to your medical professional, you need to make sure you're taking it as directed, not shrinking the amount of days, not affecting the amount of hours that your dose, that you decide you can take it this time and not that time, so that you decrease the likelihood of the medication no longer being effective for you when you need it later down the road. Okay? Because we are definitely seeing an uptake of this. So although the movie is looking at it, that's probably a virus, think about it in the cases of if there was an outbreak and you were to encounter something that you possibly could have fought off, but you couldn't because your immune system was already compromised because of these other incidents that happened before. Or a medication that you were prescribed no longer worked or wouldn't work for you because of how you abused the medication before. As a practitioner, it didn't work because you didn't give it out correctly to the people within your community or niche. Okay? So that covers our 3 areas. So again, I'm waiting. Oh, can't hear you. Hold on a minute. What? Huh? What's the medication? Or what's the medication? What's the topics we're talking about here? Okay. So our 3 topics that we covered out of this segment was responding to emergencies, attracting disease, and treatment that inadvertently causes disease. That's the 3 we covered for chapters 9 through 12. So how we looked at NIMS under responding to emergencies, the National Incident Management System, operational periods, as well as common terminology. We talked about attracting disease, what we can do in our community to find out how healthy our community is and what we can do to better aid it. And then we also talked about treatment that can affect disease, and we spoke about antibiotic resistance and what we can do as professionals and lay people to decrease the likelihood of that happening. Okay. So I really enjoyed this segment. This was one of my favorites. This part of the movie is actually one of my favorite parts of the movie for chapters 9 through 12. Next week, Monday on September 10th, will be the last. Wow, the time fly by. So that will be our last, and it will cover from chapters 13 on. So from 1 hour and 22 minutes to the rest of the movie, we'll be covering it the next week. Please, 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 questions, comments, concerns, anything, right there. Make sure you put them in there. I really want this to turn into a forum. Hopefully some of what we talked about got your juices flowing, thinking about, even if you're a professional, maybe looking at it in your community, what you could do to improve things. I'm hoping that we can get this discussion up and going, and please share so that all of us can add to that discussion too. So I look forward to seeing you guys next Monday, and I hope you have a wonderful week.